Good, happy Tuesday evening, December 1st, 2020. I'm Riley King, and welcome to this Tuesday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday evening, so let's begin. First up, we're going to begin with COVID-19 updates. New Hampshire COVID updates, new information and data. Let's take a look at that right now. And here is a look at that information for all of you. Right now, there are 20,994 number of people in New Hampshire have tested positive for COVID-19. 13,525,889 number of people in the United States have tested positive. 526 number of deaths from COVID-19 in New Hampshire. 839 number of people have been hospitalized with COVID-19 in New Hampshire, and 888 number of deaths of COVID-19 in the United States. Now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Nashua, 465. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Nashua, 2036. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day. New Hampshire in the purple, daily new positive COVID-19 cases. Orange, new hospitalization, and red, deaths. Now let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases. In orange, current hospitalization. Let's take a look at this chart here. Total cases. Purple, total positive COVID-19 cases. Total hospitalizations, orange. Red, deaths, and blue, recovered. Let's take a look at this chart here. Positive PCR test rate and daily PCR test. Let's take a look at this chart here. Age group of cases, female and male of cases, and risk information. Let's take a look at this chart here. Infections, hospitalizations, and deaths. And let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. DHHS officials investigate string of COVID-19 cases stemming from New Hampshire House GOP meeting. House officials did not specify number of cases connected to the caucus meeting. Let's take a listen to that video from WR News 9.
New Hampshire Chronicle, now in its 20th season. Watch new episodes weeknights at 7 on WMUR.
And right now at noon, state health officials are investigating COVID-19 cases stemming from a meeting of the New Hampshire House Republican Caucus at McIntyre Ski Area back on November 20th. The incoming GOP majority has 209 members. In a statement to News 9, HHS did not specify how many cases it is investigating, but does say contact tracing is underway. In a statement, House Republican leader Dick Hinch said the caucus is cooperating with contact tracing, and he has no reason to believe that positive members will attend the outdoor swearing-in at UNH tomorrow morning.
Okay, and there you go on that video and that report. Nashua School Board extends remote learning into 2021, approves winter sports plan as well. Epidemiologist says data shows residents are taking second surge of COVID-19 seriously. Let's take a listen to that video from WMUR News 9.
days, we found smarter ways to do things. Find a smarter way to learn with FlexPath from Capella University.
Nashua School Board has voted to keep students in all grades fully remote through January 18th, Martin Luther King Jr. Day. The board also approved a plan for winter sports. All basketball and hockey players must wear a mask to and from facilities during practices, on the bench, and during games. No fans are allowed from visiting teams. The board also approved a list of other schools that Nashua will be able to compete against. Sharing a border with Massachusetts brings unique challenges to Nashua. Public health officials say they are following the state's lead in the second surge, moving from containment to mitigation for contact tracing.
We have about 397 active cases right now and 418 active contacts. So it's a lot, but it's good news too, because the case to contact ratio is about 1-to-1.
And Nashua's epidemiologist says that 1-to-1 ratio suggests that the virus is not spreading to large groups and that people are taking the surge seriously by limiting contacts and cutting back on social activities.
Okay, and there you go on that video and that report. State health officials monitoring increase in hospitalizations warn of delays in testing results. Cases continue to rise. Let's take a listen to that video from WMUR News 9, Tim Callery.
Fall home improvement season is taking off at Beltate's Building Supply. From building materials to tools, paints, and everything else you need, we'll make fall home improvements a breeze. Shop online at beltates.com. Visit one of our 9 locations or place your order via phone or email.
Now, there are 160 people in local hospitals seeking treatment for COVID-19. That's the most New Hampshire has seen at any time in the pandemic, according to state epidemiologist Dr. Benjamin Chan.
And highlights the significant community spread we have in all areas of our state.
Chan says that means hospitals are at risk for seeing continued increases in hospitalizations and could possibly reach their limit.
But as of right now, there continue to be enough beds and healthcare services statewide.
Should a hospital hit capacity, Chan says there are plans in place to deal with that.
Hospitals have internal plans to be able to find ways to increase bed capacity within hospitals. And then on top of that, the state also has plans for standing up what we call alternate care sites.
Chan says an increase in community spread also means an increase in demand for testing, which will lead to a delay in turnaround time for results, especially with an added post-Thanksgiving rush for testing.
One of the ways we're looking at trying to mitigate this increase is by trying to move out antigen-based tests into primary care provider offices, hospitals, more closer to the point of care, where people who might have symptoms can get test results in as soon as 15 to 20 minutes.
And Dr. Chan stresses that those antigen tests are really for people who are showing symptoms. So if you're looking for a test because you traveled or you may have been exposed to the virus, your best bet is using a PCR test. Reporting live tonight, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. Today is Giving Tuesday. Granite Staters asked to support New Hampshire nonprofits for Giving Tuesday. Giving Tuesday especially important as many nonprofits have had to cancel fundraisers during the pandemic. Let's take a listen to that video from WMUR News 9, Ray Brewer.
Nonprofits really make a difference in our lives every day.
And for many of those nonprofits, Giving Tuesday has become increasingly important in carrying out their missions.
They are helping clean our environment. They're keeping natural resources as well as cultural resources alive. And, of course, taking care of people who need them in crisis, in food, in hunger, shelter.
One of those organizations is the New Hampshire Food Bank, which works with about 400 others around the state.
They're all telling us that we see new faces and new families every week. We're seeing it at the mobile food pantries.
A gift of time, a gift of blood, or a gift of money this Giving Day.
The Red Cross says this time of the year there is a need for blood, but there are other needs as well, especially if you can volunteer a little bit of your time.
Our workforce is about 90% volunteer driven. There are boots on the ground, and if you have a little extra time to give, we'd love for you to join our volunteer ranks.
Our programs are all about teaching music and performing music.
Programs that are now all online. Still, the Apple Hill Center for Chamber Music says perhaps the arts have never been more important. And this Giving Tuesday, consider a donation to an artistic group.
Art brings people together, and people right now in this time of distance really need to be together, to feel like somebody's doing something for them.
Many nonprofits had to cancel their fundraisers this year or take them online, and so they say this Giving Tuesday becomes more important than ever. Reporting live in Manchester, Ray Brewer, WMUR News 9.
All right, Ray, lots of ways to give back, and another way that you can help is through our Spirit of Giving toy drive. It's gone virtual this year. You can shop from our online wish lists, choosing which items to give. Two groups that could especially use some help this year are ages 0 to 2 and 10 and older. You'll find links to those wish lists on our website and our mobile app.
Okay, and there you go on that video and that report. Exeter Hospital plans expansion to Cancer Center. Exeter Hospital is proposing a 6,417 square foot addition to its cancer center aimed at enhancing the experience for patients. The proposed expansion is estimated to cost about $9 million. New Hampshire ski areas preach know before you go. Ski areas are ready for a winter season with renewed skier interest and new COVID-19 precautions, including reduced lodge capacity and the potential for restricted lift ticket sales on busy days. 5 Concord employees contract coronavirus. 4 Concord Police Department employees and a City Hall employee have contracted the virus during the past 2 weeks. 5 Concord employees have contracted the coronavirus during the past 2 weeks, according to city officials. 4 of the employees work in the Concord Police Department, while 1 worker at City Hall. The cases were reported as the state of New Hampshire sees an increase in positive test results after tripling its test capacity during the summer and many months after city councilors approved a face-covering ordinance which was supposed to limit the spread of the virus. Since that time, the state enacted its own mask mandate. Concord Police Chief was informed Monday that 4 of the city's police department employees have tested positive, according to a public information officer for the city. The employees sought testing after becoming symptomatic during the week of November 22nd. 1 employee, a patrol officer, called into a shift after having some days off and tested positive. She said another contracted the virus while on vacation. A 3rd employee became symptomatic after working on November 23rd. That employee tested positive on November 29th. They have not been working for 8 days, the spokesperson said. A 4th employee worked on November 16th and began remote work the next day. After returning to the department for 3 days, the employee began experiencing symptoms on November 20th. was tested 2 days later and was informed of the positive diagnoses on Monday. A fifth employee who works in City Hall has also tested positive. That employee has not been to work since November 20th and had no contact with the public. These incidents appear to be isolated and the individuals had no contact with the public, the spokesperson said. The employees are currently isolating at home and recovering. The spokesperson said the city was committed to ensuring the safety and well-being of its citizens and employees and will continue following the guidelines set forth by the state of New Hampshire and the CDC. The cases are the first cluster of coronavirus outbreaks connected to city employees or facilities since late September and mid-October. Concerned residents should contact the New Hampshire Department of Health and Human Services at 603-271-4496 for more information about contact tracing or COVID-19. And that is it for this evening edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your evening, and I'll see you back here tomorrow for another newscast. I'll have a news report coming up in a little bit. Good night and goodbye, everyone.